Our second guest today is Dr. Thomas Braza with Summit Plastic Surgery and Dermatology. Well, welcome back to the show, Dr. Braza.
Well, thanks for having me. I appreciate it.
I think it's been about a year since we had you on last.
It's been a good year. Quick year, but good year.
They go fast.
They do go fast.
Well, great. It's a pleasure to have you back. And I think let's start off by you telling our viewers a little bit about yourself, because for the folks who didn't meet you before, let's start there.
Well, my name's Thomas Braza. I'm a dermatologist and Mohs surgeon, which is a skin cancer surgeon. And I joined a practice here about a year ago called Summit Plastic Surgery and Dermatology. I had been in Atlanta for about 8 to 9 years practicing. And our family decided it was time for a good move, and we found this job opportunity and moved here and just love it. It's been a fantastic year.
I'm sure your family's loving living here.
They do.
It's a great
love
way
going
of
to the
life.
beach and pool every day, and
Yeah, that's really nice. Well, tell us a little bit about Summit Plastic Surgery and Dermatology, about the services that you offer there.
So, Summit Plastic Surgery and Dermatology is kind of an all-encompassing type practice where we have general dermatology, skin cancer surgery, and also plastic surgery. So we vary from seeing patients who have rashes and acne to lots of skin cancer, and then also doing a lot of the plastic surgeries with breast implants, facelifts, tummy tucks, things like that.
All that good stuff.
All those good things, and Botox and fillers, all those things. And we have 2 offices, one in Supply and one in Wilmington.
Oh, great.
And I kind of spend my time half and half on each.
Oh, do you? That's great. Now, you said you've been with the practice about a year, so
Yes.
I assume that you've seen quite a few things while you've been here. You've done a little bit across the board, so really gotten your feet wet. But today we want to talk about a new technology and treatment called blue light therapy.
Yes.
Now, I understand that that's relatively new at the practice.
That's correct.
So tell me about blue light therapy. What is it?
So blue light is something we got about a few months ago. It's been around for probably over 5 years. My previous practice had it in Atlanta, and it's a great way to treat what we call actinic keratoses, which are these sun damage spots we get on our skin, which we call precancer spots. And it's all done in the office. There's nothing that has to be done at home. Everything's taken care of in the office. And it's a great way to approach people's skin to reverse sun damage, get rid of a lot of the precancer spots, and really kind of clean up their skin, we call it, to help prevent skin cancers in the future.
Now, you mentioned AKs. I think you call them AKs. Tell me a little bit more about those things.
So AKs are actinic keratoses, and those are what we call the sun damage spots. We use the term precancer. I explain to my patients when we use the term precancer, they're not something that would turn into the cancer called melanoma, which is the more scary type of cancer, but they could turn into what they call squamous cell carcinoma, which is a common skin cancer we see. And the actinic keratoses are the pre-version of a squamous cell. So when people get these from years of being in the sun, they get these kind of rough little white little spots.
Yeah, little scaly things.
Scaly little things. They can be a little sore sometimes. Sometimes they look like little horns on our skin. We like to treat them because 10% of them, so 1 out of 10 of them, might turn into skin cancer. And we just don't know which ones, and because of that, we treat them all. And there's different ways to treat these precancers. A lot of people probably had things frozen, use liquid nitrogen.
Taken off.
So we freeze with liquid nitrogen, which is fairly straightforward. And that's good if you got 1 or 2. But some people come in, it's their whole hand, or they just got a lot of them on their face. And you can treat the ones by freezing them, but it doesn't get rid of the underlying sun damage. And so what we like to do with those people is do more of a generalized approach and treat all of the precancers. And there's different ways of doing that, from creams, chemical peels, and then this new therapy called blue light.
So how does this work? What do you put something on the skin and then you sit under a light? Or?
Yeah, so the blue light, it's called blue light because the light's blue. And what happens is the patient comes in, we put this medicine called Levulon, which is a photosensitizing medicine on their skin. So let's say we're doing their face. So we'd put it on their face, and they would sit for an hour. And while they wait, the medicine gets absorbed into the precancer cells, the actinic keratosis cells, and kind of converts them into a cell that makes them very sensitive to light from the sun, and also from light just from the room. And after they sit for an hour, they sit under this blue light, and it's called that because it is blue, and it's a little machine. They just sit there. It's about 16 and a half to 17 minutes. They sit there, and then once we're done, we put sunscreen on them, put a hat on them, and send them home. Okay, but it's all done in the office, which is nice. There's nothing to do at home. It's all fairly straightforward. You know, we usually have them bring a book to read or something while they're waiting for that hour.
And how long would this treatment last?
So you treat it that day. They have to stay out of the sun for 48 hours afterwards.
48 hours.
48
That's not
hours.
too
So
bad.
pretty much, if we do it on, let's say, a Thursday, no sun on Friday and Saturday. And when we mean no sun, no sun. I mean, you can't go play golf, can't play tennis. You got to really cover up and wear a thick amount of sunscreen.
Can you go outside though with a hat?
You can go outside if you have a big hat on, and we actually give people a hat.
Oh, do you?
That the company provides for us.
And the sun doesn't penetrate.
And it's a big,
that.
like, brim hat.
Yeah, because my husband will put on the straw hat and it has holes in it.
Yeah,
so,
yeah.
I mean,
This is one of those, like, UV hats
Yeah.
that blocks the sun real good. And so they have to stay out of the sun, and what to expect, what they're going to see is that it's going to get kind of red, a little scabby sometimes, almost like a sunburn.
Sunburn.
Yeah, and that heals up over the next few days, usually in about a week or so, and pretty much fairly easy to take care of. You just wash your skin like you normally would, and just like I said, be out of the sun for 48 hours. And then the results show up once it heals. Typically, we do 2 treatments about a month apart. So we treat it once, a month later we do it again. Then after that, they'll see the doctor again, just evaluate and see how everything did. People really like it because it's fairly easy for them. It's all done in the office with insurance. Medicare covers it, and if they have a private insurance, we just pre-approve it ahead of time, so people don't have to go get a prescription or anything like that. The medicine we buy and we put on the patient, so they don't have to worry about anything from a prescription standpoint. And it's they like it because it's easy. Pretty quick recovery time.
Well, if you have too many of those little spots and you get frozen, you've got all these little...
Get little spots.
So this way it does it all at one time.
Yeah, it gets the whole field, as we call it. There still may be a few left that we may need to freeze or something, or sometimes do another treatment with the blue light. But it's a great alternative than just freezing.
Say you had the top of your head done, for instance, a man.
Like me.
And would you have to have it done like in a couple more years, or
typically, so we do it, the 2 treatments, see them back for their skin check, and if things look great, maybe once every 2 years we may need to do it. Just depends on how much sun damage they've had and how well they responded.
Yeah, well, I'm curious. I heard that getting this is sort of like a chemical peel that.
Yeah, it is sort of like chemical peel. So really, it revitalizes your skin. I mean, it can,
Really?
reverse the sun damage and even the skin tone. And so when you see it, your skin, and once it's gone through the process and it heals, it really looks younger because it's getting rid of all that sun damage and smoothing the skin out.
Well, I know that there are lots of other procedures that they've performed at Summit Cosmetic and Plastic Surgery, but this sounds like something new and exciting that I think folks could benefit from out there.
Yeah, I mean, it's great for the actinic keratosis. And, sometimes I have patients that come in all the time. We just keep freezing and freezing and freezing and just never get anywhere. And this is just a nice alternative. Right. I mean, people tolerate it well. There's a little stinging and burning while you get it. Some patients say more than others, but it only lasts for a short period of time and are pretty pleased with the results.
Yeah. So for viewers out there who might be thinking about this or might be interested in it, where should they contact you?
Sure. Well, they can either go to our webpage, which is summitcosmeticsurgery.com, or they can call us on our number and just make an appointment. We'd like for them to see one of the providers.
Come in for a consultation first.
And usually we bring in for a skin check your skin, and then if blue light, if they're a candidate for blue light, we set that up for them after that.
And you do all the pre-approval and what have you.
And everything's
for
pre-approved ahead of time.
Insurance and what have you.
Exactly.
Great. Well, don't wait for another year to come back because
I
you
know.
always have such great stuff to tell us.
Yeah, it's great.
So we look forward to having you again, and thanks for coming today.
Yeah, I appreciate it so much.